Let me go across to Dr. Bagai, who's joining us, the chairperson of NEFRIN. Dr. Bagai, you must explain to us. There's a difference being cautious and being alarmist. What must we as citizens do?
Hi, good afternoon. So I think the message is very clear that there is a rising number of cases in our neighboring countries. It will only be wise, prudent and common sense to take precautions. Taking precautions doesn't mean panicking or creating an alarm, but it's a question of protection not only of yourself, but of your near and dear ones and of your community at large. We know that this is airborne. We know that this virus can travel up to 60 feet. It can linger on in closed environments up to 9 hours. So why would someone with even a little bit of not wear a mask? It is a non-invasive, non-pharmaceutical measure to control and spread of infection, the ingress of infection and outgress of infection. It can give you a protection rate of nearing 87 to 90% to prevent transmission of Correct. By wearing a mask, a well-fitted N95 mask is one of the simplest tools which we have to prevent the transmission of infection. And I think whoever are the political people who are not wearing it, it's setting a very, very poor example in front of the country. And these are the people who actually, if you ask me, should never be in politics to begin with.
Dr. Bagai, do you think now government should be setting up certain orders? You have super spreader events which could be taking place, which may be on the way. We don't know so far if there are any such protocols which have been put in place. Do you think the government should start as the way we did, that these are the number of people you're allowed and nothing beyond that? Those restrictions are absent this time.
I think public health messaging should start all over again. Mentioning the benefit of masks. Unfortunately, all over the world, people have a short memory for these preventive measures. So we need to continue at it on a daily basis. And more importantly is to inform the public that these are the nature of super spreader events. I don't think we need to be curbing the movement of people as yet, but I think advisory, including a travel advisory as far as people coming in and out of China, at least for a period of within a period of 2 weeks, that should be kept in mind.
Right.
And simple screening protocols for people who have cold, cough, or fever, and the message of isolation.
Absolutely.
And keeping at home in case you are unwell.
Well, these are simple steps that the good doctor has advised. Hopefully, everyone's going to follow suit, because remember, COVID may have returned. Thank you so much, Dr. Bagai. Doctors also who are joining us. Dr. Rajiv Das Gupta is also here on our show. Thank you so much, Doctor, for speaking to us. You must explain to us what is the steps which currently need to be taken as an administration. This is public as well as private players who are in the health industry to ensure we are prepared.
Thank you. What the health minister, the union health minister, underscored in his review yesterday are 3 or 4 things. One, that COVID is not yet over, certainly not. The pandemic status still remains. Second, that mask has been advised certainly for crowd situations, and in fact those who are vulnerable should avoid crowded places. The third thing that the government has decided and emphasized is to increase surveillance, and that responsibility is on district and local health administrations. And as a part of that, genomic surveillance will be increased. Also, those who haven't yet taken the booster dose should take the booster or the third dose.
How long does the booster dose really work? You must explain that also, Dr. Das Gupta, because many people have taken it, but it's been quite some time. Even with a third dose, many have spent close to a year now having taken that.
That's correct. In fact, I myself took it on the first day of the booster, which was 10 January this year, which is almost a year now. The important thing about boosters, or those who have taken boosters, is, and that's what the Omicron phase has shown us, is that it will certainly protect against severe disease, against hospitalization, and against mortality. Some of the currently circulating forms, including BF7, which is in discussion now, because that's what seems to be driving the surge in China, at least in some of the larger cities, are all Omicron subvariants, and therefore this experience should serve us well.
Well, do stay on with us, Dr. Dasgupta. I'll just come back to you. Madhav, we expect a stepping up of the protocols. The Prime Minister's had crucial meetings. Several of the Chief Ministers are having meetings at the state level as well. Do we expect more curbs, perhaps even penalties to be put in place in the coming days?
Well, at this point of time, I think it's very clear, it's amply clear that what is happening is at the level of surveillance. They are, in fact, going to be checking randomly those passengers who are coming into the country, particularly from China and other countries where there is spread of the current variant, which is also believed to be one that spreads quite fast, as is being seen on ground in China. And therefore, in fact, as far as the government is concerned, it is more of preparedness and caution. It's going to be wait and watch is what we understand. Yes, there has been an important meeting that has taken place at the Ministry of Health's level. We do have information that the Prime Minister is also going to be reviewing COVID preparedness at a meeting at 3:30 today. So it's not just at here, the centre, as you rightly mentioned, states also that are looking into this issue, particularly those states that have huge international traffic inflows. So having said that, at this point of time, the government at least says, and many of those within government have indicated to us that they are much better prepared than they ever were during the first, second or third waves. There is a lot of infrastructure that has been put in place. All it takes is to plan and prepare to ensure that all of that is mobilized and in place in case of any eventuality. What is also, of course, a huge boost is the fact that we have most of the population that has been vaccinated, a significant chunk that also has taken the booster dose, particularly in the cities, as we were discussing earlier. So
and that has been one of the most alarming features, that the number of people who have taken a booster is abysmally low, which is why questions are now being raised as to what needs to be done to ensure that more people go and get their boosters, and also Masks Up India. That campaign for times now has returned as well. Thank you so much.